Hey everyone, Elizabeth Scally here. Welcome back to our vlog, recovering from elbow surgery from our perspective as a patient. I had elbow surgery in July. Why do I keep saying that? I broke my elbow in July and I've had the surgery in August. After the surgery, I had subsequent important appointments with surgeons or interventional pain specialists or second surgeons for second opinions. I had a very complicated recovery, and while yours may not be the same, this information could be helpful for you. Today I wanted to talk to you about a really important topic, something I should have known better and done myself. Bringing caregivers, a loved one, bringing someone with you to really important appointments. So why would you want to bring someone with you to an appointment? You personally are like looking at the doctor, making eye contact with the doctor, nodding your head to the doctor, and kind of just taking it all in, right? So you need a second pair of ears to take that information in, first off. Secondly, you might have questions and you may think of questions, but you may forget your questions, or you may not think of all the questions. So another important thing to have someone else there is so that they can too ask questions for you, or from their perspective as the person that's going to be taking care of you. Finally, if appointments go awry, you as the patient are likely to be the most emotional. This is your body, and this is your elbow. This is your surgery. This is your recovery. And sometimes emotions get high, especially if emotions become regulated, especially if you're getting information that is difficult to receive. I'm going to give a quick example. I had a follow-up appointment with my surgeon 1 month out from surgery. Because of the global pandemic that we were going through during the time of my surgery, all of my appointments and everything that I was doing had to be alone. There was no visitors allowed in offices at the time. There were no people that were allowed with the patients unless there were extenuating circumstances. Long story short, I went to my 30-day follow-up visit alone. And already at that 30-day follow-up visit, I knew something was wrong because my arm was just not getting better. It wasn't moving like the occupational therapist and I wanted it to. I had questions from the occupational therapist. I had like a list of questions to bring the surgeon. I was alone. The surgeon was there with the physician assistant, and the surgeon's delivery of the information and the way I received it did not go very well. So I became sort of hysterical. And at the time we were all covering our faces with masks, and I was sobbing into a mask. I kept saying, nobody would give me a tissue. They just stared at me, stoic, without emotion. And looking back, it would have been really helpful to have a neutral party, my caregiver, my husband, to be in that appointment with me, to kind of speak from a place of less emotion and to give the facts and to listen to the surgeon's reply to the facts that were happening in our home. And maybe that appointment would have gone a different direction. Maybe the outcome would have been smoother. Maybe my recovery would have moved more quickly. Either way, that is a story. That is a specific example. That was a time when I thought, as I was leaving that office in tears, wow, I really should have had my husband with me. So bring a loved one, bring your caretaker person, bring your partner, bring someone to an appointment. They can listen for you. They can ask questions that you forget to ask. They can bring up concerns that you're unable to articulate, and it's just another person to have that dialogue with your treatment team. The more ears, the better, because the treatment team speaks in the medical language. The patient doesn't always receive the medical language very well, and having another set of eyes, another set of ears, and a neutral, calm, regulated emotion state of that other person would be really helpful. So bring someone to all of your important appointments. Visit me at elizabethscala.com for more resources related to healing from elbow surgery, and I'd love to help you in any way I can. So leave a comment or question below. Thank you. See you next time.